Bonjour chers patients et patientes, alors je viens de commencer le travail, on va voir aujourd'hui ensemble une patiente qui a fait l'opération hier. Elle a fait une mini abdominoplastie, liposuction avec une opération d'esthétique mammaire si je ne me trompe pas. On va rentrer ensemble. Bonjour. Hello. Can I come in please? Thank you. How are you doing? Do you feel after this surgery? Everything is good?
Yes, fine.
This may be painful. Hi sir. How are you doing? Good?
We need to know what the aftercare will look like.
So can we have a seat to speak a little bit about that?
Yeah, sure.
I even can explain to her if you have a meet, so if I'm bothering you.
Listen, but you
Exactly.
explain.
So generally, like after a plastic surgery, after one night, we explain to the patient all what he needs to do and not do about like the post-operative care. For example, you cannot take a shower by yourself. There will be a private nurse who will be coming to the hotel. She will change the tapes of the surgery, the corset, and even provide lymphatic massage. We're gonna provide lymphatic massage in the hotel. What is your question?
How frequent will the nurse visit? So will she
Every
come
day.
see her every day? Yeah?
She will visit you. You will not need to come here. She will visit
I
you.
understand that, but will she turn up to the room, knock the door?
Exactly. She will come to the reception. The reception, they will call you. They will ask a request to approve the nurse to come up to you. She will come with all the equipments and she start doing the massage. And even after the massage, if she would like to do like a bit of cleaning of your body, she can do that for you also. She can help in this. The surgery was successful. You don't have really any problems about that. Even the surgeon said, I have seen your pictures, by the way. I will just show them to you. I think, do you want to see that? You can see this is you before the surgery here. And let's go here. So if we're gonna see the after, as you can see, we have removed this fat. We have done implants here. This is the implants result, and this is the even the good thing that you have is like you didn't had a big scar of abdominoplasty, a very short scar. So for the drains, first of all, you need to keep them for the first 2 or 3 days.
Yeah, they said 4
This
days,
is very
yeah.
important. The nurse, once she come to the hotel to visit you, she will empty them once they are full. The advantage of putting something like that, and the very good thing is they are so active in your case. This is something good because, as you know, when you provide the liposuction, your lymphatic system start providing this liquid to protect the body.
Yeah.
But that's why we implant this kind of drains just for the couple of days to empty the body from that liquids, because that can even help the body to have the shape of the surgery as soon as possible. Question?
So when the drains are removed?
The drains are removed on the check-up day. 1 or 2 days before your flyback, we're gonna take them off.
But when the drain comes out, the hole...
Gonna be closed automatically because it's a hole of 2 millimeters only.
Okay, so you don't need
Yeah,
to
it's
sew.
a very small. We don't need even to put any kind of stitches there.
Okay.
Yeah.
Okay.
So the main thing is also to keep the socks for 7 days after the surgery. It's very important. When you are lying on the bed, sometimes you can move your legs also to avoid having any kind of blood coagulations or embolism. This is also very, very important. Yeah.
Will she be given spare?
Corset, we offer automatically a second one in the package. Now when the translator will come to discharge you, he will order 2 corsets for you that will arrive to the reception. Once the receptionist of the hotel receives that, he will call you, you go down and you bring that for her.
Okay.
We're going at some point today. Will we see the nurse in the hotel at some point?
Absolutely. No, not for today,
Not
because
today.
today already the nurse here gonna prepare you. They will take off the cannula that you have in both hands. And also they will, I don't know if the doctor came or not to see you today.
Not my doctor, but I think
A doctor.
Another one of the staff, yeah. He just
He
see and
inspected
exactly
and was
everything
happy.
is perfect. So the nurses, they will prepare you now. They're gonna give you also a medical suitcase with the antibiotic, the painkiller, and the healing
so
cream.
it'll be oral now and not...
Yeah, it's tablets to take exactly for the first 7 days. About the painkiller, you will use it once every 4 hours, just in case of you need it. By the way, how was the experience? How is the plastic surgery?
How is it? Oh,
Yeah.
I don't know, a bit.
Painful.
Yeah. Yeah, I don't
But
really
good.
know. Yeah, it was good. It was
Happy
good.
with the result.
Obviously, anticipation at the start, but we're done now. And
No issues at all with the service at all, and everyone's been really friendly. And as
I'm
you say-
speaking more about the medical side. How was the post-operative care here? Especially with the nurses and the translators.
well, I
That's
think
for you
it's,
to answer, isn't it?
I feel it's been good. Like with sort of like the translators, there's always one goes, another appears, and they're
Everyone's
always
really
very happy
helpful
to help.
and really friendly.
Yeah.
So no issues at all with the aftercare so far. Obviously, we're
With the
still early
coordination,
days.
yeah.
We're only 1 day in after surgery, so that we're yet to be decided on whether that care continues when we're then back at the hotel and feel that we're still getting the care that she requires in order for her to get better. But as so far, so good.
Perfect. So that's all. Any questions for me? Medical questions, especially. Yeah.
I say it's quite normal to have pressure there, isn't it?
It's very normal because your breast volume was small, and
Yeah.
then in 1 second the doctor put like 300 or 250. I don't.
280.
290. So this is very normal.
They say 280.
It's like you can imagine that you have a hand inside. It's something like that. So there is a huge pressure. I recommend you to eat a lot of protein. This is very important because that can improve your muscle volume on the breast, and that can get more adaptation with the silicone which is inside. About your love handles, back and tummy, I don't recommend you to make any mistake to gain any fat weight, because that's not recommended after liposuction. You need every time to keep by doing gym and a good diet
I
to
love
keep.
gym, but you can't do weights and stuff for about
And
6 weeks.
after 1 month you can start holding like heavy weights, doing like entrance exercises without any problems.
So
After
we're about
4
like
weeks
10 kg.
you can start slowly and you
Yeah.
go up on the weight about the exercises. Yeah.
Sexual intercourse.
Sexual, yeah. Really it depends to the person, because I cannot tell you that there is an exact day that when you can. There is patients starting from the 7th day they can, as there is patients starting from 2 weeks they can, as there is patients after 3 weeks.
So
It
only when
because
feels okay.
because our operation, it's a superficial surgery. I never touched her bariatric or sexual system. I'm just taking off the skin and the extra fat. So once the patient feel comfortable to that, he can do it.
No problem.
Any questions?
That's it.
So that's maybe the second day after the surgery, or the first day. I forget. It's maybe the first day, yeah?
Yeah.
Exactly. It's first. Yeah, perfect.